In this recording, we're going to discuss bone repair. So sometimes we get a little bit wild and crazy and we break a bone, we fracture a bone. There are two main categories of fractures. We have simple fractures, which the skin and tissue around the broken bone remains intact. Or we have compound fractures where basically your bone is sticking out of your leg, y'all. Okay? Sticking out your leg. You have also damaged the skin and tissue around the bone itself. This greatly increases your risk of infection, also known as osteomyelitis. Now, we can further subdivide fractures, okay, based on how the fracture occurred or what the fracture looks like. We have green stick fractures, which are often found in children. This is an incomplete bone break, so basically one side of the bone breaks, but the other one is not broken. Okay. We have compression fractures, where basically you have crushed a bone. This is common with osteoporosis. So compression, so maybe the vertebral column, the lower vertebra are being compressed more than the upper vertebra because of the extra weight on those vertebra as you go down your trunk, and so sometimes those lower vertebra can start to be crushed. A depression fracture, basically the bone has been pressed inwards. So think of somebody getting hit on the head with, I don't know, a hammer. Don't do that. Please don't whack somebody with a hammer, y'all. But that would cause the bone to push inwards. So that would be a depressed fracture. A spiral fracture occurs basically when you've twisted the bone so hard that it breaks. These are common sports injuries. And then a comminuted fracture, you've basically just destroyed your bone. The bone is broken in 3 or more places. Again, this one's also often found with osteoporosis because the bone is so weak. And so you can see some of our pictures here showing these different types of fractures. Okay, so if you break your bone, we're going to have to fix it. We're going to have to do a little bit of bone repair. And this isn't too bad, y'all. This isn't too bad. So step number 1, and this is going to sound silly, but step number 1 is you're going to bleed. You're going to have a hematoma or a blood clot that's going to fill the gap between all the bone fragments. I know, you damaged yourself, y'all. You have a boo-boo, you're going to bleed, right? So step number 1 should make perfect sense. Now, those blood cells and the proteins, everybody's going to kind of blob up here to kind of fill in that injury until we can start taking the blood and replacing it with cartilage. So step number 2, we have fibroblasts and chondroblasts are going to make their way to the hematoma, and we're going to get rid of all the blood, and we're going to start laying down cartilage. Okay. In addition to the hyaline cartilage, we're also going to lay down collagen as well, because remember, collagen is a main component of the organic matrix of the bone. So we're laying down cartilage, we're laying down collagen. Step number 3, osteoblasts come in and they turn the cartilage into bone. Okay, they create what's called a bone callus. You might hear it termed hard callus, bony callus. It's callus. Okay, whatever type of callus you want to call it. You are, and here's our blown up picture of it. Okay, so we have turned all this cartilage into legitimate bone, but we've made this bone callus. We've made it a little too big. See how it kind of pokes out just a little bit, Okay. We're going to need to remodel that callus. Okay. We do that. It's kind of like shaving off that little excess. Okay. That little bit of excess. So I almost call this like step 3.5. Okay. But technically it's number 4. Okay, but the primary bone that we just built, we're going to replace it with more mature secondary bone. Um, we've built the central canals, we've got the lamella and all that good stuff. The primary bone didn't quite have that. So just kind of internal restructuring a little bit. When the remodeling is done, the callus is gone, and you have nice, mature bone tissue. And then you're done.